Well, in November of 2010, I just got sick. I thought it was a cold or a sinus infection. And I went to my family doctor, but he was not there that day. So the practitioner gave me a shot and said, you should feel better by this afternoon. I didn't. I still felt horrible. So I went back the next day, and he did blood work on me, and the first thing he said, you're not going home, you're going straight to the hospital. I think you got leukemia. And this is a person that's never hardly been sick in her life. It's like all at once, I didn't feel like I was going to live. I didn't have pain, but I was so weak. I couldn't hardly walk or anything. And I didn't know what was really going on because I'd never been sick like that. So when I got down there and Dr. Bridges came in, he says, you've got acute leukemia, and I think there's another word for it, but I don't know the whole medical words, and he says, we're going to have to treat this very aggressively. I wasn't comfortable going to Birmingham, but I didn't really have a choice because they didn't treat me up here, and I had to go. And they just came right in, started working on me, and like I said, he said, we're going to treat this very aggressively. I didn't know what that meant, but I soon found out with all the chemo and all the other medications that they give me, but I felt like he was taking care of me. Even though I didn't feel good, I felt like he was taking care of me. Dr. Bridges is the type, he notices every little thing. And I was wearing a lot of dark colors, and he said one day, he says, what's with all this black? So you know what? That made me start paying attention, and I started dressing more colorful, and I thought, well, it does make me feel better. I told him the other day, I said, Dr. Bridges, I said, you promised on my 5th year anniversary you would cut my trips to Birmingham back to once every 6 months. He said, I did, didn't I? So he did, and I told him, I said, you know, it's hard to believe. Here I am, 70 years old, been through what I've been through, and I take 2 medications. He said, it's just unreal for anybody 70 years old to take that little medicine without being through what you have. It was I just felt at home at the office, and like I said, his whole staff they're just so nice. And they had one little lady that worked in the office, I don't remember her name, but she always telling me how pretty I look. And after my hair come out and come back, it was curly. And she'd tell me how pretty I look. And I thought, that's so sweet. She's over there working on her computer. She don't have to say anything to me, but she went out of her way to compliment me. I take some pretty strong medicine, and he says I'll take it the rest of my life, but I'm just so happy I've had these last 5 years that I wouldn't have had otherwise. And I still sometimes have to pinch myself to think, because I've got great-grandsons that I wouldn't have seen, and all these little babies, and without that, I wouldn't have been here to see all that.